Hi everyone. I wanted to reach out to everybody because there's a lot of false information going around and there is a lot of panic. It is, of course, a very, very dangerous disease, but we shouldn't panic. And the reason we should speak to more patients who have recovered, because 85 to 90% people have recovered. uh, 20 days back, I was tested positive. I am negative now. I have almost recovered. But I wanted to share my experience because when I was positive 20 days back, there were very less people that we knew who were COVID positive, but suddenly everybody left, right, and center is positive, and we really need to speak to more recovered people to feel more confident about dealing with disease and all the disciplines. So, I want to tell you all COVID is very well a manageable disease. 85% of you will be able to manage, and do not worry about it. The only way to handle COVID is a discipline. Let me tell you, it was very unfortunate that I was all alone at house. I took care everything on my own in terms of food and everything. But it taught me a lot. So I want to give you that confidence that when I handled it alone in a house, you will be able to handle it too. And I'm pretty sure you will have family in other rooms with you. It is a discipline. There are few steps that I would want to share with you and keep it in written. Um, if you have come in contact with any COVID positive patient, just isolate. Please be responsible. Please isolate. Do not wander around here and there and saying, "Mujhe to nahi hoga." It's a very wrong notion. Second, if you get symptoms like bad throat, cold, diarrhea, fever, loss of smell, taste, in some cases, headache, lethargy, and you're constantly sleeping, then you need to get yourself tested immediately. If you are positive, then reach out to a doctor. There is a standard prescription with additional one and two medicines here and there that your doctor is going to advise as per your condition. Standard is paracetamol, Dolo thrice a day if there is fever. Antibiotics, multivitamins. There's a medicine, ivermectin, that doctors are suggesting, but please reach out to them before consuming it. Uh, Next step is monitor your oxygen and fever thrice a day. If you don't have fever but rest of the symptoms, then you're completely fine. It's a mild COVID. Just chill at home and read book and self-reflect and sleep. If there is fever, but it is coming down to normality, 99 or lesser than 99, with your use of medication, then again there is no state of panic. A normal viral fever takes 3 to 4 days. In some cases, it's taking 5 to 6 days, but it is completely normal, which it just means that your body is responding to the medication and you are in complete control. If the fever is consistent, even after 6 and 7 days, and with consistent, I mean that it is 100, 99.5 or 100 plus, the fever is not coming down than 99 even after using these dolos and paracetamols, then raise an alarm, but do not panic. In alarm, I mean to say, reach out to a doctor. They might be able to explain that what is the gap, that why is the patient feeling it, but do not panic. There are people who are handling it for 10 days also. uh, don't try to hoard Fabi-Flus and Parfovir and all those medicine without doctor's advice. There is a very there is a very small subset where it is prescribed. It is prescribed in the case of elderlies where there is fever greater than 102 and the fever is consistent, it is not coming down, then it is used as an SOS. Please do not try to hoard it. I don't know where people are getting this information that my doctor has asked me to keep Fabiflus. I don't think any learned doctor is advising that. Um, if the oxygen level, the other part of it is, if the oxygen level is 92 and above, please again do not panic. A lot of you be vigilant, but do not panic. uh, when I had fever, my oxygen was also dropping to 93, 92 also. But one should not panic because it's fever and it comes back to normal. Walk for 6 7 minutes. It will show fluctuation in fever. It shows fluctuations. If the oxygen is less than 92, then you have to be double vigilant because you are now in a different bracket. But again, saying do not panic. Please walk for 6 7 minutes. See if it is coming above 92. Basically, why the blood thickens, the blood circulation in the body slows down. So please manage that. And another thing I want to tell you is diet. People take their diet. The people are not taking their diet seriously. They're saying, obviously, it feels while during a fever you don't want to eat. You're like, mujhe nahi khana hai. All if there is fever, you all the more don't want to eat. It is my sincere request to force feed. This is a disease you have to handle alone. You have to isolate yourself. You can't seek help of others beyond the limit. It is not fair to anybody. Please force feed yourself. Eat dry fruits, eat high proteins. Vegetarians to eat paneer, non-vegetarians to eat this thing, egg whites. But you have in when you have a virus going on, and especially virus plus a fever, then your body is consuming 20 to 30 times more calories to fight that. Is why you sometimes will also feel pukish because your body is famished. You are either not hydrated well, your organs are also getting dehydrated. So please, diet, it includes 3 to 4 liters of water a day. You are having medications. Do not take diet lightly. If you don't want to eat, have food like medicine. Just eat it. Steam 4 to 5 times a day. It really helps in killing your virus in your nose, residing in your nose and throat. It is also supposed to be used as a good practice by COVID negative people also. If you go, because you do not have 0% exposure, you are getting groceries or in some cases maids or to buy essential outside. Just like a good habit, when you wash your hands, take 3 to 4 minutes of steam instantly. And COVID positive have to take steam to keep your throat and nose moist, because till the time it's not moist, the mucus will not come out. It will start to congest here in your chest or all in your nose. Lastly, another good habit is coconut water. It really helps in hydrating the body and brings down the body temperature. It is suggested by doctors even in severe fevers of jaundices and typhoids. You need to have coconut water. And lastly is actually this is second last is recovery. That it leaves you with prolonged weakness. That is true. It took me 2 weeks to get back my to do away with this weakness. I still don't have my strength back or my stamina back. But do not, after recovering, please do not try to do intense exercises. Do very gradual stretches. Do not take this lightly, because your blood, as a side effect, thickens. You can't torture your body with a lot of intense workout where your blood is not circulating enough, and you can see people might be fainting if they're doing intense exercises after COVID recovery. Give yourself time, do normal stretches, don't do heavy exercises, but exercise, even that is necessary. Do pranayam, yoga, surya namaskars. Uh, and lastly, please vaccinate. Uh, I can't I can't force enough to say that it is one of the most important thing. Please vaccinate. I know so many people, because I hail from a defense background and the frontline workers have been vaccinated. There are infection cases, but trust me, there is not a single severe case. Everybody has been smoothly dealing with it. There is no fatality I have at least seen in so many number of cases, and there is no hospitalization that I have seen. I also know elderly comorbids who have been vaccinated and dealt so smoothly, much easier than even I have as a youngster. So please do away with any inhibition regarding vaccine you have. Every vaccine is good. And if there is a better chance of living, if there is a better chance of dealing this disease with lesser severity, then it is C. Please, all the best, guys. Reach out to me in case you need anything. Please, we are all in this together. And please speak to more and more people, whoever have recovered, and calm them down.